Greetings. This is Justin Allen with the Elite Nurse Practitioner. Welcome to the Elite Nurse Practitioner Show, podcast dedicated to nurse practitioner entrepreneurism and achieving financial freedom, where I talk directly with nurse practitioners who need help. Listen up, our market is saturated. Jobs can be scarce. We are underpaid. We are undervalued. We are taken advantage of by the sharks within the healthcare system, and frankly, screw that. Sick of it, and it's time for a change. And listen, I'm here to help make that happen. We are powerful. We can forge a path where we are in control of our career and ultimately our financial and personal well-being. You do not need to submit to healthcare administrators and your doctor overlords. You do not have to take a measly salary. You do not have to work 50 to 60 hours a week. There is a different way, and I'm here to show you that path. This podcast is raw and unfiltered. I have not talked to the nurse practitioners in this podcast prior to the call outside of an email exchange to schedule the episode. What you're about to listen to is a consultation session between a nurse practitioner and myself. It is real, it is unscripted, it is unplanned, and I have no idea what we're going to talk about. Anything and everything can happen during our conversation. The nurse practitioners in these episodes are struggling with an issue in their professional or financial life, and they have reached out to me for help. My goal is to help the nurse practitioner with actionable advice that will enhance and improve their professional, business, and financial life. My other goal is to hopefully help my nurse practitioner sisters and brothers build a more productive, powerful, and free life. So I hope the content and information within these podcast episodes does just that. All right, onto the episode. All right, the first nurse practitioner we're going to talk to is Melinda. She is located in Arizona. She operates an aesthetics and wellness practice. She is looking for some assistance with marketing her practice to increase her patient volume, improve patient retention, and to just increase her overall revenue and to grow her practice. She's looking to scale her practice and bring it to the next level. Hey, Melinda, how are you?
I'm good. How are you?
Hey, I'm doing pretty good. Hey, thanks for hopping on this podcast with us. This is a brand new podcast for the Elite MP, and I'm excited that you're joining us. So thank you very much.
Yeah, thank you for offering it and doing this for everybody. It's been great. I appreciate what you do.
Cool. Awesome. No, definitely my pleasure. So listen, let me just kind of just jump right into this. So bring me up to speed. So how long have you been a nurse practitioner for? Where have you worked? Where you're at in your career? Just give us a good summary of just where you're at in life.
Yeah, sure. So I was an RN bedside for about 10 years. I did most of that time in the ER. So I worked for multiple different companies. I like to do registry. I'd like to have variety and switch things up. So a little bit into it, I decided I could not stay bedside in the ER indefinitely. It just got rougher and rougher. So
no, it sucks.
It takes
burnout city.
It takes a toll on a gal for sure.
It does. Yeah. Okay.
And I loved it. I still love it. But anyway, sure. I couldn't do it forever. So sure. I've been a nurse practitioner for about 2.5 years. I had kind of an interesting start to my nurse practitioner career. My very first job actually was with an interesting situation where I ended up traveling and doing what is known as stem cell injections. I started in Arizona and then I branched out and I did them in like 8 different states. So that was kind of an interesting introduction to my nurse practitioner.
Okay. So you just jumped right into that whenever you got out of school.
Yeah, that was my first gig right away. Okay. That was kind of a crazy story, but I'm super glad it gave me a huge foundation for what I love to do. But
sure. So let me ask you, do you feel like that you got into that stem cell gig just because of like market saturation? Like it was hard to find a job like in the ER or in the urgent care or whatever? Or is that something that you just kind of saw a job posting and just went with it?
Ultimately, what's going to feed into our discussion is I made the decision that I didn't want to spend my entire life only making what somebody else told me I was worth an hour.
Sure.
So that was something different. And it was posted as more like joint injections, wellness, preventative care. So honestly, I didn't really know what the job was when I applied, but I thought like, okay, well, I'd rather do preventative and help people live a better life and feel better than be giving Percocet and having people yell at me every day. Right.
Sure.
So
sure.
I did that, but it was a very part-time deal and I loved it. But I then got a job full-time as a medical provider in the jail system in Arizona.
It's a big change.
So yeah,
Yeah.
Although it was kind of just like the ER, to be honest.
Right. Sure.
So yes, the stem cell, but my foundation really was the jail. I had acute care, I had chronic care, we had trauma, I did codes, I worked in the women's jail, so I had women's health. I technically had pediatrics because we had juveniles incarcerated as adults. Okay. I could do procedures. It was a really great foundation for me to say, okay, I can be functional on my own because I've kind of seen it all very quickly.
When you were working in that jail, were you did they just kind of just throw you in there, or did you have like a doc or another NP kind of like assisting you and helping you out, or like how was that dynamic?
There were a couple physicians that ultimately were like the medical director, and it was kind of half NPs, half PAs. And there usually was more than one of us at a jail at a time. So I had experienced PAs and NPs with me to bounce ideas off of or have questions. And our medical director was pretty phenomenal. So
okay. So it was
if there was
pretty good support
crazy,
system.
I had resources. Yeah. It was
yeah.
great. So I then decided again, in the jail, they're not really looking to take care of self and improve their quality of life. They're in jail, right? So right. I really wanted to focus on wellness and health and people that wanted to be preventative and active in keeping themselves well, as opposed to what can we do to fix something that's bad. So I started kind of my side business, thinking I would slowly transition out of the jail. But with COVID, with mandates and loss of jail staff, the safety in the jail decreased rapidly and I didn't feel safe. So I quit that job, hoping that I could quickly build my side business into a business that could sustain myself and my family, at least till I got it built up where it was more beneficial than just a side gig. Do you know what I mean?
Sure.
So that's where I'm at right now.
Okay. So can you bring us up to speed to, just where you're at financially? Yeah. Do you have like a lot of savings and emergency fund, those sorts of things that you can kind of like lean back on?
So personally, yes, we do have some. Do I feel like I'm confident and secure for the next 6 months? No. Okay. As far as the side business, I wasn't in a position where I could really front a lot of money up front as far as, 5-year leases and a whole business space and staff. Sure. So I opted, and I kind of interact some on the Facebook page, but I opted to get a suite in a salon suite in a nicer part of town.
Okay. So, and you're still there?
I am still there. Yes.
Okay. What's your income like now, and how long have you been operating this, this little side practice?
Okay. So I opened in April and kind of started, and then
April of 2021?
2021. Yeah.
Okay. So about 6 months.
Yes. Shortly thereafter, I had some health issues and ended up needing to undergo some fairly significant surgery. So I didn't even walk in the door here for 6 weeks. So that kind of put a hold on me being able to advertise, because how could I market and say, yeah, make an appointment in 2 months? I didn't feel like I could do that. So I've started to get back. My income right now, my gross, what I bring in is probably maybe $800 to $1,000 a week.
Okay. So this is really just in the infancy stages of this little practice.
Yes.
Okay. So what kind of services are you offering here?
I was hoping to really focus on stem cells, which we can't call stem cells anymore. So connective tissue allografts and regenerative medicine. And then for those who are in this space will know that the FDA came out with a fairly strongly worded letter in June. None of the regulations changed, but it did kind of change the way people can market. The community knows it as stem cell injections, but I can't say stem cell injections. So that's not something I can market or put on Facebook or anything like that. So the other things that I've been doing is I do cosmetic injections, IV therapies. I've been doing some weight loss, hormone replacement, men more than women, and some peptides.
Okay. So you're doing quite a few different things. So, you have a generalized wellness practice is what it sounds like. You're offering multiple service lines here. So with that said, which ones are the most profitable so far? You've only been doing this really You had surgery, you were out. So, I mean, in all intents and purposes here, 4 months maybe. So what are you finding to be the more profitable service line?
My IVs. IVs by far have been the most frequently used service, although it's the service that I've marketed or tried to market the least.
Well, you know what? That's just how it goes sometimes. Yeah. Okay. Now, listen, though, the thing that you got to remember here is that let the world tell you what they want. Okay. So don't tell the world what they need. They'll tell you what they need. So if IV infusion is just happening to be one of those things that you're like making the most money off of, then, instead of reinventing the wheel here, why not really try to push that more if that's what's bringing in the money?
True. Well, yes, I agree with what you're saying. I think maybe just because it's the lowest profit per item, right?
Yeah. It's not as profitable as HRT or stem cells or aesthetics. I agree. IV infusion is pretty much a volume game. I mean, you have to have volume to really make, a lot of money doing it. And I'm assuming your space is probably not set up for that.
I mean, I can do 3 infusions at a time in my little suite that I'm in. So potentially I could do 3 infusions simultaneously, but I do 2 quite often, but not usually 3.
Okay, gotcha. What about the other service lines? What about like HRT, for example? What's that looking like? Are you seeing many patients?
Yeah, I would say I see quite a few more men than women. I have done some pellets on women. That's been kind of fun, but I'm not as comfortable with that. So I probably don't market that as much. But more men testosterone replacement. I do have several of those patients. Yeah, I do probably more that. That would probably be the second one. As far as the cosmetic injections, it's kind of hit or miss. I do have patients that come back, but they come back, every 4 months. So it's not like a consistent monthly expense. And then it is nice if I get a stem cell patient here or there that will float me for several weeks just because
those are high dollar.
They are. Mm-hmm.
So then mostly it sounds like the HRT and the IV is really kind of the big winners here so far.
Yeah, I would agree with that statement. Yes.
Yeah. Okay. So out of the $1,000 a week that, that you're making, is that $1,000 in revenue or $1,000 in profit?
Revenue.
So out of that $1,000 a week in revenue, what percentage of that would you say is coming from IV and HRT?
I would say IVs maybe 30%.
Okay.
And the other I do have the weight loss, the ones that are doing the semaglutide. That's a higher item. So the weight loss and the HRT would be covering up the rest.
Okay, gotcha. So really the aesthetics and the stem cells is not really generating much of anything.
No.
What do you want out of this? I mean, what service line really burns the fire in you? Like, what would you like to see happen here?
Honestly, what I would love to see is an increase in probably male hormone replacement. I did like this great training with Gainswave in Florida and, fillers and injections and P-shots and all of those things I think are valuable for quality of life. And I like making people feel better. And I think men, that's the easiest. It's undertreated and doctors aren't willing to prescribe it. So
no.
That's probably where I would love to focus the majority of my efforts. But as we know, that's probably the hardest thing to market adequately on social media.
Very difficult. I've pretty much almost given up marketing my men's health clinic on social media. It's just such a headache. I'm not going to get in any kind of political debate here, but social media is primarily liberal kind of thing. And they don't like men's health and they will they won't approve it. They'll approve a transgender transition HRT ad all day long, but they will not approve a men's testosterone replacement therapy ad. It makes no sense. But anyways, though, yeah, it's difficult, but don't let that be a roadblock for you. I mean, my men's health clinic's doing $50,000 a month in revenue and I don't advertise on social media. Like, you don't have to. I guess with that said, I mean, if you feel like that men's health is something that you really want to focus on, what's stopping you from doing that? Are you kind of in that experimentation phase of this practice, offering so many different services and kind of just seeing what bites?
I think part of that, and I maybe have hesitation about how to get the word out. Where would be the best place to go to advertise? Yes, for the IVs, but for the men's health. It's even the marketing that I've done and trying to filter it down to specific jobs and age groups and whatever, I have had zero return from any of the marketing I've done for any men's health.
Even IV?
I have gotten nothing from social media for IV. Every IV I've gotten has been from a Google search. Every single one.
Well, I mean, now Google search is extremely powerful. A lot of people overlook it, but if people are looking for a service line and you're ranking, on the first page of Google, or you're popping up on Google Maps, it'll work really, really well. I mean, people are searching for you, so make it easy for them to find you. You know what I mean?
Yes.
I would say easily 80% of my men's health patients simply comes from a Google search, because I rank number one. So they see my clinic and then they see, the 55-star reviews. And there's another men's health clinic that opened up in town. They have like one review and they're struggling. I just completely overwhelm them. You know what I mean?
Okay.
And so, so being found on a Google search is really one of the most powerful tools that you're going to have for a men's health clinic, and even like other niche lines too that are hard to advertise, like medical cannabis. You can't advertise medical cannabis. So you have to be easily found. That's where Google, that's where the Google search comes in. And so if you want to focus on the men's health clinic and really start trying to blow that service line up, then I wouldn't bother with social media. I wouldn't even really fool with it. It's difficult and there's not much of a return on investment on it. That's just been my experience and the experience of a lot of other people. All right. I hope everyone's enjoying the episode so far. I just wanted to take a quick break to thank everyone listening and also give a big thank you to all of my social media followers and email subscribers. If you haven't done so yet, please subscribe to our email list at www.elitenp.com and make sure to follow us on Facebook, Instagram, and LinkedIn. Email subscribers will receive updates on new weekly podcast episodes, multiple weekly articles we publish, new courses, and everything else related to helping you succeed. Remember, all Elite Nurse Practitioner courses are designed to help you build a niche practice, increase your financial strength, and to break free from the rat race. If I can break free and that other countless nurse practitioners can break free, then so can you. Additionally, please share this podcast with your other nurse practitioner sisters and brothers out there. The more NPs that venture out on their own, the stronger our profession will become. Now, let's get back to the episode. I guess let me ask you this. I'm kind of going down a rabbit hole here. Is your website just more or less just like all these general service lines and stuff on it?
Well, I don't know how to answer that. I mean, I have a page for each service line. I have pricing, and then I've been doing blogs, with whatever, every couple of weeks or so, putting on blogs with trying to get those keywords and doing the different type of topics that I've been doing.
Good. Okay. No, that's really, really important for, for search engine optimization. So you're doing that correctly. I think that if you want to do men's health and really, really focus on that, I think that you need to make a totally separate website and do a DBA or even form another separate LLC for men's health specifically. Because if you can put men's health and testosterone in the name of the practice, it is just so damn obvious what you're doing.
Okay.
I mean, there's absolutely zero question what there is that you do. And so when someone goes to Google and types in, men's health or testosterone replacement therapy or whatever, and your clinic is named whatever men's health testosterone clinic, I mean, literally it leaves no question, right?
Okay.
Yeah. And so that might be something to really think about here. I think that would be extremely cheap to do. You get a nice little men's health website up and running for $1,000 and create a separate Google listing for it, and people will call.
Okay. So do a separate LLC.
You can, or you can just do a DBA under the LLC that you have now. You could do that as well for the time being at first, just to save yourself some money.
Okay.
I'll just give you a quick example. So when I first started, I opened up like an opioid addiction Suboxone practice at first. And it was just like a generic name. And when I started my medical cannabis clinic, so I closed the Suboxone clinic down just because it wasn't really working out for me. And I opened up the medical cannabis clinic. I just operated as a doing business as underneath that LLC because I didn't want to form another LLC.
Okay.
Yeah. So you can just do a DBA. You don't have to really register for that. Some states require that, but some states don't. I'm not really too sure about Arizona. It's just a DBA. You just basically put the LLC name just at the very bottom of the website, and then you can just call your men's health clinic whatever you want.
Okay.
Yeah.
That's a good idea. I hadn't thought about that. Okay.
And that'll just save you some money too. So you don't have to form another LLC.
Okay. Separate website.
And have a separate website. Correct. Just keep it like separate. Yeah. Like I see a lot of these wellness practice websites, and, they have separate pages on the website for every service line they do. And it's hard for those pages within the website to rank on Google. Like it's hard for people to find those. But if your website is strictly for that service line, it's much easier to find.
Okay.
So I'd recommend doing that. Like if you really want to focus on the men's health thing, that's what I would do. And then social media, you certainly can try. Okay. I have had ads approved for men's health and testosterone replacement therapy on social media. And the trick for it was in like the wording of the ad, like just type in, men's health clinic now open, free consultation, something like that. And then in the image, you like put the word testosterone in the image, and right. Facebook's algorithm, they won't find it. There's very few actual people looking at these ads. It's all an algorithm. It's all just a computer basically scan, and they just scan the ad. And then if there's words that are flags, then they'll just deny the ad. It's just an automatic thing. No one's actually putting eyes on this. So you get around that by putting the words in the image, so the scan doesn't really pick it up. Does that make sense?
Yes.
So that's what I've done with my men's health clinic to get Facebook ad approved. So like the wording in the, the headline, what they're actually scanning is just, men's health clinic now open, call for your free 15-minute consultation, right? Provide an offer in the ad, free consultation, right?
Okay.
We get all kinds of free 15-minute consultations, just a quick little phone call. But in the ad, I had a picture of like a guy who was kind of athletic, and it, had my clinic's name, and it said men's health clinic, testosterone replacement therapy, growth hormone optimization, weight loss. And I got that thing approved.
Okay. Yeah. Because even weight loss ads, I've gotten those all kicked back too.
Yep. Yeah. It's almost impossible. Okay. Yeah. You cannot I guess Facebook's reasoning behind it is that they don't want to hurt any kind of special snowflakes feelings. And so if you're insinuating that someone needs to lose weight or has a problem, then the ad's not going to be approved. So just kind of keep that in mind. Yeah. So I think if you did that for the men's health line, I think that it would probably just start generating some pretty decent business, with men's health cash. It's kind of a slow game at first, but then 3 to 6 months, later, it really starts picking up quick.
Okay. Yeah, that's a great idea. Now I'm sitting here, mind spinning with that option. I hadn't even considered that, but that would be, if I'm doing all the blogs and specific on that website for those things, then that site itself would end up ranking higher.
100%. Absolutely. And especially if you put men's health testosterone in the name.
Okay.
Absolutely. That thing will rank up really quick. Do you have competition in your area for men's health?
I don't. Not where I'm at. There really isn't much around. There's some east of me and some north of me, but not really where I am.
How far away are those places?
Oh gosh, maybe 20, 30 minutes.
Are you in a pretty high population, density area?
Yes. And it's a fairly affluent area. So there's discretionary income where I am, which is part of why I picked where I did. But yeah, and there's really not a lot of men's health or the IVs any place nearby. So I kind of expected those things to pick up a little bit more. But the IV, it's just that the hormones not as much. But that's a really good idea.
Yeah, I mean, you're sitting on a gold mine. If there's no one else in your area, within a 30-minute radius, and it's a pretty high population area, then, you're sitting on a gold mine here. People would much rather see you, 5 minutes away than drive 30, 45 minutes across town.
Yes. That's been the huge thing with IVs. A lot of my patients also have been like, well, I've been going to, whatever, I'm in Arizona, but in Scottsdale, which is a much more affluent area of metropolitan part of Arizona. So the fact that I am closer to where they are, I've actually had several patients that said, you're so much closer, I'd rather do that than drive there. So that's beneficial for me too, just location.
There it is. This IV thing, if it's kind of taking off for you and you're not even really even trying, imagine what you could do if you tried.
Right.
you know?
Yeah, that's what I would love.
Yeah. And this is the great thing about IV infusion is you could get an RN or an LPN in there to do the IVs for you. And you just sit back and sign up on the standing order.
Right. And that would ultimately be, ideal for me. I do love doing, dabbling in different things, but if I even had a second location, but I just need to get to the point where I have things up and running enough that I'm in a position to bring someone else on. But that's my plan this was a jumping off point and I'm just ready for it to jump off so I can get to where I always wanted to go.
Sure.
Which is where somebody isn't telling me what I'm worth an hour, that I can determine, my financial future. So that was my whole goal in doing this.
Right. I mean, you're on the right path. You're doing it. I mean, you took action, which is more than what most people do, when you actually started this thing. So now I want you to think though, real quick about the IV infusion and outsourcing the work. You could do that with very little risk if you pay the RN or the LPN production. And so there's very little risk on your end because they don't make money unless they're doing an IV.
So basically pay them a percentage or part of the IV they do as opposed to time spent.
Correct. So pay them like 20 or 30 bucks per IV. And so, the average IV costs anywhere between $20 to $50 in supplies, depending on what kind of IV it is. So it costs you $20 to $50 for the IV. You pay the RN 20 or 30 bucks. So you're looking at $70 or $80 overhead per IV. You're charging $150 per IV. You're sitting back making $70 or $80 per IV and you're not doing anything.
Yes, that's my hope.
Right. So that's pretty much a passive income source. That RN or LPN could be there when you're not even there doing the IVs. And it's very little risk for you. Like you could literally do that next week if you wanted to.
Okay.
Something to consider as just another service line. You know what I mean?
Or just focus a little bit more on that since that's the one that's picking up anyway. Okay.
Right. The world's telling you what they want. So just deliver it to them.
Okay. That
deliver the demand. Yeah. Just provide it. If you were going to go down this route, especially with the men's health, this salon that you're in, is it kind of more of like a female kind of dominated salon? I mean, how do you feel like men are going to?
That was an initial concern that I had. With that said, I would say all of my men's health patients at this point in time are police officers and we have no issue coming here.
Sure.
I've known a couple of them, so I've asked. So the location hasn't seemed to deter them from what I found.
Yeah, and that's pretty much true with just men's health in general. They really don't care. They just want treatment.
Right.
A lot of MPs ask if being a female provider deters patients, but they don't care. You haven't sensed that at all?
No, I think the biggest thing is the ones who've come to me, they're grateful that there's somebody that will prescribe because either providers that they've gone to have stopped or their primary care says, no, you don't need it. There have been certain issues with that. The thing of it is, I think the men's health clinics and stuff that are even remotely around me are incredibly expensive. So I think that that's been a thing too, being more affordable and not as ridiculously priced has also been a drawing point.
Oh,
but
absolutely.
Again, it's just been hard. I would have thought that cops would talk more at work, but apparently they don't as much as I thought. So I was kind of counting on that word of mouth a little bit, and that did not seem to pay off the way I expected, I guess.
Well, it's only been, a few months, right? So
that's true. Yes.
Yeah. I mean, I pretty much treat the entire police department at my men's health clinic, but we've been open for 3 years. You know what I mean?
Okay.
I mean, it only started with just a handful of them and then, they talk and word kind of slowly spread. So that will happen. I mean, it'll happen if you just give it some time. In terms of the pricing goes, what are these other clinics charging? I know you said it was just ridiculous. What are...
From what I've seen on the low end, probably, I think the lowest end I've seen, or they're getting charged about $300 to $350 a month.
Holy shit. That's ridiculous.
Yeah. So I've kind of used, I think, I don't remember which course. I've done several of your courses, but there was one where you made a comment or whatever about, try to have like each patient that you're like $100 profit on that patient per month.
Correct.
Right.
Yeah.
So, depending on what they want, I have not been able to find, it's been harder for me to get pharmacies that would allow me to get bulk orders to do injections in the office. So I would say 100% of my patients, I've taught them how to inject, and they inject themselves and the pharmacy shipped to them. But I have them paying me for the product and then I order it. So that's been happening with that. But I think overall, I tried to keep it about that $100 a month mark plus product is where I've been.
Right. So your goal is $100 a month profit
Per patient.
Per patient per month. Yeah.
Yeah.
Yeah. If you focus on that number, you'll be profitable. It just takes a little time. Now, with that said, for testosterone in clinic, you can use Empower. They give in-office use testosterone.
The 30 mLs. Yeah.
Correct. Yeah. But your goal here should really be for them just to be injecting at home, exactly like what you're doing. Them coming in for injections, that just increases your busy work.
Yeah.
So you're doing it right. So try to stick to that. Try to avoid doing injections in clinic if you can. Are you charging per vial?
Yes. So basically, okay, so let's say hypothetically they're going to be on 100 milligrams a week, right? So that's a half ml. So like I'll say it's $100 a month for me to manage it plus your product, and I can order the product for $25 a month and it'll be delivered to your house.
Okay.
So they pay me that basically $125 a month. I order the product, 2 mLs, and then every month they have to text me and say, hey, I'm ready for, reorder. And then it gets reordered when I hear from them and I reorder it. If I don't hear from them, it doesn't get reordered. I was trying to manage reorder on my own and I couldn't. So that's basically once I hear from them, then I will order the product. If I don't hear from it, it doesn't get ordered.
Yeah, it's almost impossible to keep track of all the reorders. We do the same thing. When you're running out, just give us a call. Now, I think that it's probably not a good idea to be doing this on a monthly basis, though, in terms of their refills. Shipping costs are going to eat you alive. Like when you first get started, you don't really put that much consideration into shipping costs. But once you get going and you start like breaking down the numbers on a monthly basis, you'll just be like, damn, I'm spending a lot on shipping. And so a way around that is that give these guys 3 or 4 months at a time. They're not going to rip you off. They're not. I think I've had 2 guys in 3 years rip me off.
Well, then you could just put them, I can put the monthly cost on a recurrent subscription, right? And then just
correct.
Order that product. My issue was when I tried to do that one time, the pharmacy that I was using at the time said I could only ship a month quantity per patient at a time. So they wouldn't let me send like a 10 ml vial to them. If they were only doing 100 milligrams a week, they would only send a 2 ml vial and they would not allow me to put any refills on it. So then because even at one point I'm like, oh, well, then I'll just write for 4 refills and the patient can call the pharmacy or go into a portal and reorder. They wouldn't allow that either.
Screw that. You need to find a new pharmacy then.
Okay.
Yeah, most pharmacies don't have a problem with that. Empower, APS Belmar, Southlake, these places they'll ship up to 6 months to the patient.
Okay. Maybe I think the one that gave me difficulties and has been TaylorMade.
Yep. Yeah. We'll see. Okay. So TaylorMade's out of Kentucky. And so they have to follow Kentucky law. Yeah. So they can only ship a 30-day supply. So if the order comes from a nurse practitioners in Kentucky can only prescribe up to a 30-day supply of controlled substances, even if you're not in Kentucky. It's completely backwards. Don't use TaylorMade for controlled substances. It's a pain in the ass.
Okay. Perfect.
Yep.
I can switch to the others.
Yep. Exactly.
My peptides through Southlake.
Yeah. So just use Southlake for the testosterone. They're great.
Okay.
Yeah. So that's what I would do. I would do 3 months at a time for the patients.
Okay.
That's going to save you on shipping costs. Okay. And then just charge the patient, $125, $130 a month. And that includes the testosterone, the syringes, and the visits, right? So make a subscription plan. And then when they run out, they'll call you, in 3 months or whatever, or during your follow-up, then you just place another order.
Okay.
Super simple.
That would be way easier than monthly.
Absolutely. It's right. It's less paperwork, less administrative hassle on your end. And like I said, don't worry about them ripping you off. They're not going to.
Okay.
Do you have any other questions about the men's health aspect? Is there anything that's maybe concerning you from a marketing standpoint or a logistical standpoint?
No, I think, the suggestions you gave, I hadn't really thought of. So I think I have a lot to go on as far as just that aspect is concerned. And yeah, I guess it's good to get validation. It's not just me having the social media issue.
Oh, no.
right?
No, all of us do. It's just, it's part of it. Yeah. The IV infusion aspect. Do you have any questions or anything there? Like, I'm kind of thinking to myself here, what if you had two businesses here? I always recommend having at least 2 or 3 businesses. And like, what are your thoughts on having the men's health as kind of one business and having like IV infusion wellness or whatever as the other business? Would you be opposed to doing something like that 3 to 6 months from now once you start getting a little more income coming in?
No, I wouldn't be opposed at all. And I think, there's an aspect where it'd be like, okay, well, I'm managing 2, but there comes a point where it would be way easier to manage them separately. So no, I think that that's definitely something I'm going to start working on and see if I can't separate those out and make the men's health just specific and then the other stuff.
Yeah, I'm kind of thinking maybe like the IV and the weight loss and that kind of stuff. You can do it out of that salon, and then the men's health, you can just go get a cheap little office somewhere, maybe, if you wanted to separate it out completely.
Yeah, that makes sense. Okay.
Yeah. Do you have any other questions in terms of, the marketing or the IV or anything else?
No, I think just those suggestions you gave me have given me a huge jumping off point, and kind of focused me more on what I need to put my attention towards instead of being as broad, be more specific and focus on a couple of things at a time. And I think that that's a helpful reminder.
The narrower you can get, the better, because you can become the expert, with that service line. And it's just much easier to market that one service line than it is to market, 6 or 7, right?
Okay.
When the men's health patients come in and you get a guy who might have, chronic knee problems, he tore his meniscus in high school or ACL or whatever, and it's still giving him issues. It's not to say you can't upsell him on a stem cell injection or whatever. I mean, have it there in your back pocket, right?
Sure.
Right. But just don't make that your focus unless you want to make that your focus.
I mean, I would have loved to, but it's just not. The current environment makes it too difficult.
It is. It is difficult. I don't think it's worth the headache quite yet. Not until it starts getting, worked out a little bit better. Yeah, I think men's health and IV, I think that's a great stepping stone for you. You don't really need to do a whole lot else.
All right. Yeah, I'm excited about the men's health part. That's given me a ton of ideas to kind of focus on that. I'm excited about that.
Oh, it's great. It's easy. It's low drama. Guys just want their treatment, and you don't hear from them ever again until the follow-up. It's great. Yeah.
Okay. Nice.
Anything else I can help you with? You want to talk about anything else?
No, I think that was great. You're super helpful as far as being able to pinpoint and focus and narrow things down. And I think that's been the most helpful thing to me. And so I'm appreciative that you helped me, talk through some of my issues and give me ideas on how to focus and prioritize. So thank you.
Yeah. No, thank you very much. It was great speaking with you, Melinda. And I hope, everyone listening to this walks away finding some value out of it, and hopefully it helps them in their practice. So if anyone has any questions or if they would like to be a guest on this show, shoot me an email, theelitenp@elitenp.com. I hope everyone enjoyed the podcast, and I'll talk to you guys next week. Thanks. I hope everyone enjoyed that episode with Melinda. She is operating a wellness practice out of Arizona. She was not really too sure what she wanted to do and left the episode focused more on men's health. So the main takeaway that I want everyone to walk away from this episode with is this. Listen, let the world tell you what they want. Sometimes it's like fishing. You throw multiple baits out into the water. Sometimes you get some little nibbles. Sometimes you get some bites. And every once in a while, you will get a keeper. A big one will bite. That's kind of like starting a business. So what you do is you have multiple service lines at first, and then you have those service lines in your practice, and you see what the world wants in your little area. Sometimes it might surprise you. It certainly surprised Melinda. IV infusion and men's health were the biggest service lines that took off for her, and she was barely even advertising those services. So the world told her what she wanted, okay? So it was a surprise. So it's the same thing that you need to do, okay? Don't shove an idea down the world's throat. Let the world tell you what they want. Sometimes it takes a little bit of experimentation. Sometimes you have to just throw some things out there and see what bites. Hope everyone enjoyed this episode. Definitely more to come. If you have any questions whatsoever, shoot me an email, leave a comment, and I appreciate all you guys. Thanks. Bye. Thank you for listening to the show. Quick legal disclaimer. The content of this podcast is meant for informational and entertainment purposes only and should not be used as legal, financial, medical, regulatory, or practice-specific advice. For information pertaining to your specific legal, financial, medical, or practice-specific needs, please be sure to consult with your lawyer, CPA, medical director, and/or your state's practice laws and the most up-to-date clinical guidelines. As always, do your due diligence when it comes to any information found online and in podcast. The content in this podcast is copyrighted by Galaxy Medical Southwest 2022 and cannot be duplicated, rebroadcasted, or reproduced without our written permission.